Joining us now from New York, Congressman Charles Rangel, and here in our studio, Senator Orin Hatch. Good morning, gentlemen.
Good morning.
Good morning, Harry.
Congressman, let me start with you. The head of the Congressional Budget Office came out this week. He said the plans he's looked at so far don't do the job, nor do, and in fact, the cost of health care might go up. Have you guys botched this job so far?
No, I'm surprised that the Congressional Budget Office had these views and didn't share them with the Ways and Means Committee before we concluded our work. But it's clear that they're working with different assumptions than the White House and the Congress is. But we got to fix this terrible problem that we have in our country, and we will do it.
Can it be done without significantly raising taxes?
Well, no. It's the question of how much savings that we do have. And we were able to raise $500 billion by savings in the Medicare system, and we raised $500 billion in taxes. And we had to do this in order to reach the cost of the bill. But how much money you have to raise depends on how much savings you had. And so there's certain things that the Congressional Budget Office didn't score. Savings that we have with people not getting sick, preventive care, people not having to be readmitted to the hospital, and a variety of things that is just a question of which assumptions are you using. But at the end of the day, we will be getting together and we will have national health insurance. We have to have it for our country.
Senator, let me ask you this. A couple of the ideas, taxing the rich. The other one is especially putting a very tough tax on small business owners. Are either of those going to fly with the Republicans?
Well, we're talking about more government, more taxes, more spending. Tax the rich. Well, if you tax the rich, that means that you're going to push small business into 45.7% top tax rate, which is like 10% more than corporations pay, and it's going to kill a lot of jobs, a lot of opportunities. I don't follow why we've got to spend another $1.5 to $2 trillion, most people estimate, on top of the $2.5 trillion we're already spending in this country, and yet still have, under one estimate, at least 33 million people without health insurance. I mean, these are things that are real serious problems. I think if Charlie and I could sit down together, we get it done. I have a lot of confidence in his ability, and we're good friends. But it's become so political. The House bill's total partisan bill. The Help Committee in the Senate bill is total partisan bill. And our only hope maybe is to have Senator Baucus be able to put something together on the Finance Committee in the Senate.
The president really wants these bills before the recess so they can be dealt with after the recess. Is this all going too fast?
Well, I think so. I mean, you're talking about 1/6 of the American economy. You're talking about myriad problems here. You're talking about people who are all over the map as far as what they really want to do. And I think there's a really good reason why the president wants to do it. He knows he can't sell it if the debate lasts very long, because it is so expensive and costly.
All right. Congressman, let me ask you this, because there is overwhelming support across the country for some kind of health care reform. Same question I asked the senator. Is this going too fast? And are the ideas that are being put out there, are they realistic?
We've been dealing with this bill for over 6 months, and we've had hours of hearings, and the fact that it's not bipartisan is not because we Democrats don't want to have a bipartisan bill. We don't have any Republican answer. It's easy to say what you don't like about this bill, but it'd be far more constructive if we had something to work on. So I'm depending on my friend Orin Hatch to, at least in the Senate, to try to see, is there a Republican bill in the Senate? There certainly isn't in the House. And it's just wrong to say that this is a tax on small businesses. We exempt small businesses from a lot of the penalties. We give tax credits so that they're able to hire and get people health care in small businesses. This is a tax on less than 1% of the wealthiest people in the United States of America. And so to say that this is a penalty on small businesses just isn't so. Sure, we wish we had more time, but the president has given us a deadline. We're working under it. Our committee has reported out a bill. We're waiting for the Senate to do what? Do anything.
Senator, let me ask you this. This notion of trying to take Medicare spending away from Congress, give it to a separate sort of independent agency as one means of trying to cut some costs, any chance that that's going to happen?
Well, they're doing that in England right now, and you can't get health care when you need it, and when you do get it, it's generally too late in some areas. Look, we have a great health care system in this country, the best in the world. Republicans have at least 4 bills that would do better than this. I'm going to file a bill in the near future that basically would be modeled after the CHIP bill, the Child Health Insurance bill. That was the Hatch-Kennedy bill. And that bill would emphasize and allow the states, with all their different demographics, each state is different. Utah's not Massachusetts, Massachusetts not Utah. We would give them the money, but let them design their own plan and do it under certain very good economic
And the number of people enrolled in that has actually been going up.
Well, that's right. And frankly, well, let's be honest about it. One of the big problems is that we really haven't been invited very strongly into either bill in the House or the Senate. And there hasn't been a real interchange with Republicans on this issue. We have a lot of ideas I think would help. I don't blame Charlie for that. I blame the leadership, and I blame the president for pushing something so hard, so that they're definitely afraid that over the August recess that if they don't get this passed,
folks are going to go home and get an earful.
Well, that's right, and they are going to get an earful, because you're talking about mandates on small businesses with 20 to 249 employees that really are going to kill small business and kill jobs.
Congressman, let me ask you about the idea of taxing health care benefits as a means of trying to draw down some of these costs. Is that off the table?
Well, I can't say for the Senate. I have no idea what they're doing over there. Clearly, it's off the table. Well, everything's on the table. My committee did not put it in our bill. Any recommendations that's been made by CBO has been made after we reported our bill. They believe that it's cost saving for the administration to be able to set the reimbursement costs for Medicare. While everything is on the table, I don't see the executive branch being able to set the costs if it can't raise the taxes. And so everything's on the table. And to say that Republicans in the Senate are not involved, my friend Chuck Grassley, the senator on the Finance Committee, he spends more time in the White House than I do. So the opportunity is there for anyone to jump in, and I welcome anything that Republicans who want to do to improve this bill.
Senator, what are you going to say real quick?
Well, let's be honest about it. The real problem here is that you've got Senator Baucus, who is trying to put together a bill that would use the exclusion. In other words, would tax health care above a certain level. They're talking about $25,000 plans now and taxing above that. I'm shocked that there are $25,000 plans. They tell me they are in New York, some of them, even for teachers. Well, the problem with that is that if you don't do that, then there's a gradual push up all the time in costs, so that you have Cadillac plans over regular plans that really would work.
All right, very quickly, Congressman, has the president done enough to shepherd this through?
The president is working around the clock to do something, and I don't want to be negative about the other body, but quite frankly, they haven't presented anything to the Senate, to the House, or to the country. So the president is doing his part. We in Ways and Means are doing our part. We have a deadline. We will meet it. Right. The question is, what do we expect the other house to do? God only has the answer to that, and my friend Orin Hatch.
Senator Orin Hatch, Congressman Rangel, thank you both for your time this morning.
Thank you.